Good evening, everyone. We'll just give it a few minutes before we start. Thank you. Good evening and welcome everyone to today's webinar, which is going to be on mental health, the triggers, signs, and symptoms. I'm Dr. Barbara, a PSK Nairobi Branch Council member and the representative for retail pharmacy. Today, we are honored to have with us Margaret Njihia, a highly accomplished clinical psychologist and child therapist with over 18 years of experience in mental health. Margaret is a co-founder and the lead clinical psychologist at Starling Wellness Center, a one-stop therapy center specializing in individual, family, and corporate mental wellness. She's also the acting dean of students and head of student counseling at the Technical University of Kenya, where she also serves as an assistant lecturer in psychology. Beyond her professional work, she has been featured on NTV, Citizen, KBC, and other media outlets, providing expert insights on stress management, trauma, emotional intelligence, work-life balance, and mental health advocacy. She was recognized as a peace setter in mental health advocacy in 2023 for Africa and has contributed to national policies on child welfare and online child protection. So we are privileged to learn from her expertise today. Also watch out. Apologies, I think the call dropped. Where did it end? Or where was I cut short? So Margaret, I think you can go ahead and take us through the presentation.
All right. Thank you very much. It's an honor and a privilege to join you on this evening, and happy to walk us through this is the first part, so basically a lot more this evening on the basics, the introduction. The next part, which I think is on the 25th, we will be looking at the signs and the symptoms, and we'll be looking at management and paying a lot more emphasis on the concept of self-care in the second part. So what can we do to make sure that we are okay? So we are looking at today we'll be looking at the prevalence, we'll be looking at the triggers. Yeah, so let's get started. So it's very interesting to have this presentation with the Pharmaceutical Society of Kenya, because there is quite the meeting point between mental health practitioners and the Pharmaceutical Society of Kenya, because you're the people who come from a pharmacology perspective, while we come from a behavioral perspective as psychologists, because psychologists in the country are not allowed to prescribe, irrespective of the level of training. We are not allowed to prescribe, but we do understand quite a bit, not as much as you people do when it comes to the pharmacology. So we have a meeting point and the meeting point is also in the next slide, where we are talking about interprofessional collaboration, is where now we are talking about, so a psychiatrist writes a prescription and the prescription is brought to you. So this client, chances are that if we follow the protocol, chances are that this client started from me as a clinical psychologist. So I administered the assessment, arrived at a diagnosis, recommended for referral to the psychiatrist, and the psychiatrist also did their own assessment and sent the client with a prescription to you. So the three of us should be working together, because when they come to you, then there is your part also, even in terms of the patient education about the medication, and especially when you're in a country where there's a lot of drug abuse and drug misuse, and that's the interprofessional collaboration. I think we have that meeting point, and probably in future we need to think about how do we bring out this patient education together. So then the patient comes back to us after they have received their medication, and then we continue with the behavioral aspect of it, the treatment and the management from a behavioral perspective. Then also, we are also the professionals in this space, and, people working in the clinical setting. Does that mean we are immune to not poor ill health, it doesn't mean. So let's start with the question today. How are you feeling this evening? Please get to the chat and tell us how are you feeling this evening. What's the predominant emotion? Let's interact. It's not that I am the expert per se, but let's interact. How are you feeling this evening? It's 6, just before 10 past 6. How are you feeling? Someone says overwhelmed. What does that emoji mean? Is it bored? Is it excited? Feeling tired, hopeful, tired? Let's keep them going. How are you feeling this evening? If you can share with us, we'd love to appreciate, we would want to know, and we'll get to look at why is it important for us to do this check. Exhausted, happy, highly expectant. Thank you, Esther. Under pressure. How else are we feeling this evening? Optimistic, just okay, tired. There's an emoji there. I don't know whether it's that flat effect or what does that mean? What does it mean to be okay? To say I'm feeling okay. What is okay? If you can tell us, what does it mean to be okay? Is it, are you feeling well regulated in your mood? Are you feeling energized? Or what does okay mean? Okay, taking it a day at a time, exhausted, energized for once. Oh, I love that, Diana. I truly, truly love that. So why is it important for us to do a check of how we are feeling? When we are talking about mental health, just like you drive a vehicle, just like you drive a vehicle, and every time you get to the gas station, whether the lights on the dashboard about the battery or water or engine have lit up, you always most likely will ask the petrol station attendant to check for you the engine. And they do their dipsticks, they check everything, they check the washer. Now it is raining, so you need to make sure your wipers and everything else and your washer water is the right amount. Why wouldn't you just every time keep going and not bothering to check until the lights go off? Why do you have the practice of always wanting to check? You go to check the tire pressure even when the vehicle is not showing anything that your wheels could be imbalanced. Why do we find it necessary to do that check? Please share with us. Why are you in the practice of always wanting to check your vehicle engine, even when there is no sign for any danger whatsoever? Elizabeth says safety. Why do we do that? To avoid the car breaking down. Why else do we do that? To avoid a total breakdown. Any other reason that would make you want to do that? And I'm sure you do this regularly, for longevity, not to be caught by surprise, for assurance. I love that one. I love that, Fred, when you say for assurance. And it's gives you, yes, it's true, as Fred says, it gives you this peace of mind that the engine is okay, the vehicle is moving well. So what if you went to check and the attendant told you, oh, we need to add a bit more oil, we need to add, I don't know, brake fluid, we need to add, I don't know, transmission fluid, or, all these other things they want to add. You go and check your tire pressure, then you find one is 35, the other one is 29, the other one is 36, and that has its own impact as well. As human beings, we need to keep a check about how we are functioning in terms of our thoughts and in terms of our emotions. And the reason why this check, in the morning, how did I wake up? How am I feeling? In the evening, how is my day ending? How am I feeling? It's because when we talk about mental health, the symptoms we see in mental health, we only get to see them after 14 days or sometimes in a month. It is not something, unless of course, like in the cases of trauma or grief, where someone you can almost tell immediately where they are at. But by the time I notice I have been sad, or I'm feeling sad, or I'm a bit low, it just didn't start now. It started over time. And by the time now it's becoming evident that I am not sleeping, by the time it is becoming evident I have a change in my eating patterns, by the time it's evident that I'm feeling overly lethargic, I've lost interest in things others enjoyed, then this means whatever it is that is the trigger has been there for a period of time. And this is why it's always very important for you to do that check-in. And then the second reason why that check-in is so that you can identify what is the trigger. So for the people who say, okay, just feeling okay, what is that okay? If you say you're feeling exhausted, can we place a finger at the reason you're exhausted this evening? Is it because you had a long day? So, you're physically tired. Is it because there are other things that are happening? So if you say you're feeling bored, what is that? If you say you're feeling tired, what is going on? If you say I am expectant, so something has happened. So when we do this check, then we move to check what is the trigger. Then it helps us address and respond to the trigger in good time. That basically means we don't have to wait until, a month, 14 days later, when now you're already struggling with whatever it is that is the trigger for a long period of time. It has been unaddressed and unresolved for a long period of time. The more we keep check in terms of our thoughts, in terms of our feelings, the better it is, so that then we can respond to that. So the next slide. So what is mental health? This is a term that people use a lot. When we talk about mental health, it's not just one aspect about you. There are many things. It's a complex continuum, because it's about emotions, it's about your thoughts, it is about your social, it's about your spiritual. There are many things put together, and then it's also manifested physically. So it is not, mental wellness is, or mental health is not the absence of a mental disorder. The major depressive disorder, or anxiety, or PTSD, or personality, or schizophrenia, or bipolar. Mental health is not the absence of a mental disorder. It is the overall functioning, looking at all the different aspects about you. We're saying it's generally a state of well-being. So when you're mentally healthy, it doesn't mean I am not going to face challenges in life. That's not what it means. What that means is that when I'm healthy, I can face the challenges of my day-to-day challenges. But also it means I have the capacity to respond to them. I acknowledge, I find ways of dealing with them. I can cope with the stressors of the day-to-day life. It doesn't mean I'm immune to that. It means I have the capacity to identify my abilities, my potentials. I can work in a productive way, and it also means you can make meaningful contribution to your community, or even if it is at work, what you're doing. And it also means you can form quality relationships, because mental health is also about being aware about what is happening around me. What are these triggers? What is going on? How are my relationship like? And like someone said about finances, but not allowing those things to overwhelm you to the point you cannot work, or you cannot make meaningful contribution. It also means, because I'm aware about them, I just don't remain in the aware state, but I also do something about it. So that's what mental health is. The next slide, we look at of course, this we all understand, being in this space. So does it mean that when we talk about health, and as WHO describes that, then mental health, because we are talking about the overall well-being and not just mere absence of a disease, it's a very important component. So there's people who come to the hospital because I'm feeling pain, my shoulder, and literally for me, my shoulder is paining. So this will make me go to see an orthopedic or someone else in the space. If you had a toothache, you don't need to wait. You will be the first one to arrive at the dentist place. You'll be I will pass by the pharmacy late in the evening if I'm physically in pain. But the thing about mental health and, about mental disorders is that they don't necessarily come with a physical pain. Oh, sorry. Yes, let me increase my volume, probably get closer. Thank you for that. Because they don't come with not necessarily with the physical pain. By the time in mental disorders, or mental illnesses, you're experiencing physical pain, or this has been going on for a long time, and now it's not your mental disorder that is causing the pain, but it is the other now comorbids, and that's its way of manifesting that. So this also explains why people take too much time before they actually go to seek help when it comes to their mental health issues, because there is no physical pain. And because they can still get up and still be able to do that which they need to do. That is one of the reasons why we see a delay in people seeking help. Yes, the next slide. So, next slide, kindly. So mental wellness is this state of you can cope with stressors of life, and then you realize your full potential, you can learn, and you can do everything else that we talked about. But let's get to look at some of the statistics that tells us, is it really that bad, or where are we at? And the next slide, we look at the most common illnesses. We can move on to slide number 8. We look at the most common illnesses. Okay, great. Let's start with that slide. There are so many mental illnesses. There are those that are more prevalent, and there are those that are also more prevalent towards certain gender than others. And these are, details we can get into at a later time. But I know people think, especially in this country, that one of the challenges we have is the issue of alcohol, or the depression, what you call the major depressive disorder. But the most prevalent globally mental illness is anxiety disorder. And then again, the thing about anxiety disorder has so many other disorders in it. We have the social anxieties, we have the phobias, all, there we have generalized anxiety. There are very many of them. And that's why proper screening by a professional, using the right tools and having the capacity to interpret and analyze and score is very, very important, because people would just say, I have anxiety, but it is beyond that. There's the duration when we are doing the screening and when we are doing the diagnosis. It's not just saying I have anxiety. And anxiety disorders and mood disorders are more prevalent among women. And again, especially with the mood disorders, is because of our genetic makeup, and then the social roles that the women play, that also makes them more predisposed. Then we have the PTSDs, we have the personality disorders, and personality disorders are actually 10 of them, divided into 3 broad categories. But the most common that people talk about, which is actually not even being picked here as among the top, 6 disorders, is a narcissistic personality disorder. And it is so common today to hear people say, oh, you're a narcissist, you're a narcissist. But you see, when it comes to how common that or how prevalent that disorder is, it's not even among these ones. You can see when the substance use, alcohol and substance use is not among this one. But the thing about this disorder is that a good number of people will actually go undiagnosed. And then right now, especially what I have seen among the younger population, the teens and the very younger population, is the need to want to have a diagnosis so that when I need to pull that card that I am not okay, I can pull that card. There's a lot of self-diagnosis happening with, people going online. But as a clinical psychologist, I will not just depend on the tool. I'm going to do your history taking. I'm going to do a mental status examination. There are instances where you don't even need the screening tool because the mental status examination just tells you exactly that. So the need to actually go to the professional to get that diagnosis. And then like we can see now, the prevalence in adults, and then now you can see the highest age bracket is between, the age of 18. And that also tends to be the age bracket that is struggling even with suicide and suicidality. The highest rate is there. But the thing about the over 50s is that there's a risk, especially among the geriatrics, because dementia symptoms mimic major depressive disorder, then we also miss out on diagnosis for geriatrics with major depressive disorder. And then also because there's a lot of abuse happening among the geriatrics, which is not reported because they are threatened. So these are just among the common ones. So let's look at the next slide. We continue with the prevalence. So what is the impact of mental health related disorders? And this is a 2024 study. And you see it accounts to about 13% of the global burden of disease. And the sad reality is that 75% of these people are in the low middle income countries. And why is that a big challenge? Number one, the struggles, for because of socioeconomic status, people are jobless, the issues of poverty and the issues of abuse, and then of course, because of lack of access to quality mental health care, so they don't receive treatment. And the study talks about 1 in every 6 experience mental health at workplace. So we are also seeing workplaces as some of the triggers. And the study talked about 13% of them do not report and don't even talk about mental health. And this is the challenge to us who are logged up, this evening. Does your organization have a mental health at workplace policy? What informs what would happen to me, Margaret, if I was struggling with my work performance because of my mental health? What are the policy guidelines? Are those policies aligned with the Mental Health Act? The mental health programming at workplace also goes to support even in terms of budgeting and everything else. So it's important that as an organization, you need to go and find out what's happening at your workplace in terms of mental health. And then, of course, the study goes to tell us about 10 billion working days are lost every year to, people who are not coming to work because they've got to seek help or mental, treatment, or people who are generally struggling and they're not able to work because of depression, anxiety, substance use, and other mental health related illnesses. And that's why we are talking about 13% global burden. The next slide, we still continue with the prevalence. So 29, this is 2023, WHO talks about 29 million people. That's like half the Kenyan population was suffering from a major depressive disorder. And the thing about is, out of these 5% of adults, and you can see what I was talking about earlier, 6% women and 4% are men. And then 5.7% of these adults older than 60 years, not 60%, but older than 60 years. So again, geriatrics. So what is happening with our parents back home? So if you look at and then for me of interest is 10% where we are talking about the postpartum depression. So then again, we go back to ask, what are the mental health guidelines and policies at workplace? What do we see about new mothers? How soon do they bounce back to work? How are we supporting them? And postpartum depression, some of the triggers is generally because there is lack of support to the mothers and lack of education. And of interest was I think this is about 2020, Kenya National Human Rights Commission for Human Rights talked about, and in their study, they talked about 25% of the people we see at the outpatient facilities, and about 40% of the inpatient, they have an underlying issue that is mental health related. So we go back and would want to question what's our government programming when it comes to the mental health, and then go back and question, even in your own corporate or organization, what is the budget? How are we taking care of employees? When we come to look at the management and what organizations can do and what we can do as individuals, then we'll see how we can respond to this. But just to mention is the organization you work for, and they have a health insurance cover. What is the cover for mental health vis-a-vis dental and eye care? Does it have a waiting period? Do you have access to a psychologist? Do you have access to psychiatrists, or is it more on referral basis? And the people who are there in the panel, because some health insurance companies talk about a 1-year waiting period, especially where it is pre-existing. Then the question is, so what happens to this employee for 1 year? What are we going to do, and how are we going to support this employee? Let's move on to the next slide. I know I'm moving a little faster now. So let's look at the triggers. What's happening? And maybe before you project that, let's get to hear from those on call. What are the triggers? What are the causes? And we probably don't, we actually don't call them causes when we are talking about mental health, because they are just triggers. So what are the triggers to poor mental health? Please tell us, speak to us. What are some of these things that are putting us at risk of struggling with our mental health? Stress. Thanks, Elizabeth. What else? Life or burnout. I like that. That's Esther. Life expectations, unmet needs, money issues. I mean, this country, who is not struggling with money issues, maladaptive coping. I love that, David. That's a powerful one. Joblessness. Yes, the health diagnosis. So that's Sarah. Do you mean like the existing conditions, pre-existing chronic conditions? Of course, poor diet. There's a lot of social media pressures, work-life balance, and finances, and we can go on, and processed trauma. Thank you, Nelias, for that. Work politics and, workspaces being very toxic. I like that. And of course, the family dynamics, relationships, and we can go on, and thank you all for sharing. So when we talk about the triggers to poor mental health, then the first one that comes to mind is the individual characteristics. We can move on to the next slide, kindly. The individual characteristics. We are the adults on call this evening, the 280 something of us on call this evening. We are the product of our childhood, and our personality is developed the first 6 years of life. So what happened where you grew up? Who are the people who were with you? What kind of environment was it? Was it a stimulating environment? Was it an environment that was abusive? Was it traumatic, or generally what happened? Because there is quite the aspect of the nature in the nurture in your personality development. So when you talk about adverse childhood experiences or those childhood traumatic experiences, there are 10 of them, and they are divided into 3 broad categories. We have the abuse, where we have physical abuse, sexual abuse, and emotional abuse. And then we have the second category, which is neglect. And we have physical neglect and emotional neglect. And then we have 5 of them, all of them classified under the family dysfunctionality. And that's where we have parental separation and divorce. That's where we have chronic illnesses in the family, witnessing violence at home. That's where we are talking about the presence of alcohol and substance use at home, and parental incarceration. And the adverse childhood events or experiences was a study that was done to adults. They were the respondents, looking at what had happened to them in their childhood, 18 years and below. And we see that what happened is highly correlated with the adult that you are today, in terms of how you resolve conflicts, in terms of your communications, in terms of your relationships and your relationship skills, in terms of your sense of self-esteem and your sense of self-confidence. And all these are factors when it comes to personality development. And so for anyone who had negative childhood experiences, then they shaped that individual in a certain way that informs the individuals that we see today. Then the other thing about those childhood experiences is that chances are that they were not addressed and they were not resolved. So this means we have these things that are sort of pent up, and they've been seeking for attention and to be resolved for a very long time, and it is not happening. So because it is lying at the subconscious level, it's constantly seeking to be resolved. And this is why now you're going to see people behaving in certain ways, trust versus mistrust. Because of what happened to me in my childhood, the daddy issues we are talking about today, and the mommy issues. Maybe it is experiences of loss and grief, and people didn't have the opportunity to process that. So what is a trigger to mental health challenges today? Our childhood experiences. So when we score these 10 events or experiences, a score of 1 is serious enough. Research also goes to suggest that a score of 5 out of 10 is so severe that it suggests that these individuals later on in life are more likely to struggle with chronic illnesses. They are more likely to struggle with alcohol use. They are more likely to struggle with suicidal thoughts. And it is true sometimes when you see someone highly scoring high in their suicidality, if you do an ACE score of their childhood, then you're going to see their traumatic experiences in their childhood. So that becomes one of the trigger. And then, of course, because that informs our personality, whether you're a personality type A or type B. So the personality type A are these guys who are very competitive. They are always on the go. They are the guys who don't know how to, take a chill pill. They're very ambitious, they're aggressive. I must be the best employee of the year and working. They're doing so many things at the same time. They just don't know how to sit back. But a personality type B is this kind of a guy. I have one task, I'll carry it to the end. They're not, it doesn't mean they're not ambitious, but they're not as competitive as the personality type A. They are realistic in their outlook towards life. A personality type B will be, sorry, let me try and project again. The personality type B will be this person who, I can win today, but I can lose, and it is okay. They can easily get to that compromise. But a personality type A does not know and does not believe in being defeated. They're perfectionists, and so everything I do must be perfect. So depending on who you are and your personality type, that also predisposes you or puts you at a risk to mental health. Then the next slide, we are talking about losses. Again, we go back to what I was talking about, the significant losses in life. They could be in childhood, but they could also be in teenage. They could be, I've lost a job right now in this country. We are talking about, people working in, where they're getting the USAID funded. Now, all of a sudden, within, you wake up one day, you don't have a job, you had money, you had this kind of lifestyle, and all of a sudden you have to make an adjustment and to change. So it could be loss through bereavement, it could be loss of a relationship, through separation and divorce, or even, whatever kind of relationships. So let's go to the relationships as a loss. And when we talk about relationships as a trigger, there is intrapersonal relationship. The way you basically relate with yourself is informed by your sense of self-perception. Who are you? And this is a question I ask in every of my therapy sessions, especially at the beginning. Who is Margaret? Because sometimes the way we see ourselves impacts or influences the way we relate with other people. So there is your intrapersonal relationship, there is the interpersonal relationship, and how I relate with other people has quite a bit to do with my intrapersonal relationship. So if I grew up in a family where I faced a lot of traumatic experiences, there was abuse and all. So in my mind, what was engraved in my mind is probably mistrust. So even when I meet the most trusting of the individuals, I am still waiting for when they are going to confirm my prophecy. So I still am looking. I'm coming from a point of mistrust. And then the relationships at work. And for me, it's not the organization per se. It is us who come to the organization in the morning. Who is me who came to work? What am I bringing into this organization? What am I bringing into this relationship? What is the meaningful contribution? Am I coming from a point of trust? Or am I coming from a point of mistrust? Am I projecting in others what is actually happening in terms of my intrapersonal relationship? So if I'm constantly suffering broken relationships, and I know this sounds very mean, but allow me to say it. So if I had this relationship, it didn't work. I got into the next one, it didn't work. I got into the next one, it didn't work. One of the things I challenge people in therapy is you're the common denominator in all those relationships. Let's first look at you before we can look at the other people. And then the next slide, we're talking about, people who are lonely and they are isolated. one of the things that happen, especially coming from relationships, if you're in a toxic relationship, one of the things that these people who are toxic are going to do, and they're perfect at it, is to isolate you and make you lonely. They want to make sure you don't have anyone else around you except them. And that makes it very easy for them to continue with abuse. The more isolated and withdrawn you are, the higher the likelihood that you're a target for abuse. And that also basically means you don't have a good support system. And that goes to say that you're at risk of mental health than someone who has a good support system, someone who has, people around them, and someone who is well in a space where people appreciate you for who you are and they value you for who you are. Because in relationships, for me, this is always my mantra. If it hurts, it's not love. If it hurts, if it simply hurts, it is not love. And people need to learn to differentiate between toxic love and love, because there is a difference. Then the next trigger that is about work. We don't talk about work-life balance. We talk about work-life integration, and we'll see that when we are looking at the management. What are all the many things about you? Your father, your mother, a daughter, your friend, you're an employee, you're doing, so many other things. You need to go back to school. You need to, improve your career. You're all working towards the corner office and everything else. Is it really about these very many things, or is this just me because of my personality? That's one. Then when it comes to work-related stress, is my role, my title in the organization, is it a high stress level role, such that everyone is coming to you and you're sort of like the firefighter responding to situations? Or is it also a role that is highly stressful during certain seasons and certain periods? Like accountants at the end of the year or at the end of the month, they're busy trying to balance things. But we are talking about, is the position where you work as a pharmacist today, is it the front desk or the counter where you barely sit down because you're constantly standing? Or is it that you're working long hours? Or is it also because you're very few of you, and so this is high stress level? Are you at the value chain point where, things just have to spin and spin? So it's about the role, it's about the organization. But most importantly, do you have the skill set that you require for the job that you're doing? Because where you have an inadequacy in terms of your skill set, then it makes it very difficult for you to perform that role the way you're supposed to perform. And finally, about work-related stress, even as we talk about being overworked, is it because you don't have the support? Is it because you don't have the supervision that you need? You don't have someone mentoring you, coaching you, and hand-holding you? Or even is it because of the bosses that you're working with that generally they are not supportive and they're not facilitative? And then the next slide, it's exhaustion. What is happening with us? And I know I saw in the chat people talking about, I am exhausted. What's the cause of your exhaustion? Is it because we are all trying to work so hard and to have a side hustle and an extra job and everything else that we literally don't have time for me time, to take time out? You're constantly on the go. Is it because you're doing so many things at the same time? There's so many roles that you're playing at the same time. Or what exactly is the cause of the exhaustion? Is it because you're not sleeping well and there's the risk of a burnout? Like we said and started with a check-in, what's the cause of your exhaustion? Is it mental? Is it emotional? Is it social? Is it spiritual? Or is it physical? And where there is exhaustion, then it goes to speak to a sense of self-care. How well are you doing in terms of your self-care? And the next slide, we are talking about, being constantly connected, constantly connected. I mean, this is 6:45 p.m. We are all logged in. I'm sure some of us are on the road driving. This is the time children, those who have families, children need us to sit down with them and do homework. This is when you're in the gym and you're still logged in and trying to listen. How many of us have our desks looking like this? You have your phone, you have your tablet, you have, your laptop or your desktop in front of you. There's probably a TV, also trying to make a noise. But when it comes to being constantly connected, do we have tech-free moments in our lives? Do we have the capacity to disconnect with everything happening so that you can reconnect with yourself? I'm sure today you probably are all waiting to get, home and watch news and see what has been happening in Nairobi, the guys who are robbing, I don't know what. And we are living in an environment where there is so much noise, too much noise, too much. How many WhatsApp groups are you in, for example? And some of them, you're just a fly on the wall. You don't say anything. It's like you're eavesdropping. I mean, how many people are you following on TikTok, on IG, and, all these other social media platforms? How much time do you spend when you're connected to the gadgets and everything that is happening in the social media space, vis-a-vis the time when you really disconnect and reconnect with yourself? Like, do you have moments that this is my me time? My phone is on silent mode. I don't want to hear the TV. I'm doing my walk in the evening, and this is just me. Or just lying in bed and you're disconnected. I always wonder, for example, why do we carry our phones to the washroom? Like, why? It would tell me, guys, why do people carry their phones to the washroom? What is the need to feel connected? You're there for how many minutes? Like, literally. So what is so difficult about me leaving my phone on my desk? Why do I have to, carry it? And I remember someone telling me, what if I go and collapse there? How will I call people? And I'm like, when you have collapsed, how are you even going to be, calling people? Why do we struggle disconnecting for just a few minutes to listen to yourself and, to be with you? Why do we have our phones on, not even on mute, not even on vibration, but every notification, even at night, you can hear it? And one of the things I always hear when we are talking about, disconnecting to reconnect with yourself is, what if I get an emergency call at night? I'm like, okay, fine. But tell me, in the last 1 year, unless you're in this space where it's essential services, and your role is, it's possible you can be called at night. How many times have you been called in the last 1 year? In the last 1 month or 2 months? Why do we want to feel like we are slaves to being constantly connected? When we come to look at the management, we'll look at self-care and how these things, and especially the noise that comes with being constantly connected impacts on our mental health. So I want to leave us with this quote as we conclude today's part one. Okay, oh yeah, there's the chronic illness as another trigger, and the correlation between mental health can trigger chronic illnesses, and chronic illnesses can also trigger mental health, maybe because of the medication, or maybe just generally because of, being in this sick state for a very, very long time. And that's where also with the chronic illnesses, and especially the geriatrics, come in. Do we ever take time to screen them and find out, or is it a prescription refill and refill? And even when you're refilling with them, can you spare a minute and just find out how they're doing? Because we are now beginning to see a good number of our geriatrics who are very sick, but we think it's dementia, but it is actually not dementia. They're actually suffering, especially MDD, major depressive disorder. So I want to leave you with this quote. The next slide. You're a caregiver. What you do, if you're working in a hospital, if you're running your own pharmacy, even if you're in the supply chain, wherever it is, as long as you're in the health space, you're a caregiver. But even as a mother and as a wife and as a husband and as a father, as a sibling, we spend a lot of our time taking care of other people. But the question this evening and the challenge is, don't we think if we stopped and started to take care of ourselves first in terms of our self-care, then we'll be better people, we will have better relationships, we can work better, we are more productive, and by extension, we will not be giving other people the beaten us, the burnt out us, but we will be giving to other people the best versions of ourselves. So can we learn to take care of yourself? Because then you have so much more to offer the world than when you're running on empty. If your car can't run empty, then we need not run empty. So thank you very much. And back to the team.
Thank you, Margaret. That was a wonderful presentation. I think all of us have learned so much and things that we can implement in our personal lives and in our practices. So I think next we can move on to the question and answers, which Shannon will take over. So if you have any questions, kindly just put them in the chat and then we'll tackle them one by one. Thank you.
And comments and, feedback in terms of, please add to it.
I have a question. So as a clinical psychologist, you are obviously human, so you also go through, your ups and downs. So personally, as an individual, how do you go about them? How do you make sure your mental health is in the right direction?
Right. Any other question? Then I can come and answer that. I love your question. And I'll be as honest as I possibly can. As we wait for another question, or is that a hand, Nyambura? Okay, so let me answer. One, my work is draining, like literally very draining. If I tell you today I've been seated on this chair like from morning up to this time, meetings and sessions and, a lot going on. And it's also draining because I'm more of a caregiver in the sense that I'm working with children and especially children with trauma experiences. And then in the space of clinical psychologist, I'm working with adults. And when I go to the university, then I'm meeting students who are going through a lot. So I'm constantly listening to people who are going through a lot. So before about 5 years backwards, what I did was, mostly think that a holiday is what is going to work for me. Then I realized there is need for a holiday more frequent than I would need. So, and I do supervision, by the way, every 6 weeks without fail. I have my session with my supervisor. It doesn't matter the number of clients I've seen within that period, but without fail, every 6 weeks, we actually have a set date with my supervisor for 2 hours, just for me to also debrief and, to also present my own challenges at a personal level. And talking about that, like I know this week and last week have been very, very emotionally draining because February we have my late grandma's anniversary, and for whatever reason this year her anniversary literally beat me up badly. So when I do the check-in, how am I feeling? Then, I went back and I'm like, this feeling, there is nothing suggestive of it. Then I remembered, oh, by the way, Shosho passed away around, the last week of February. So that now I was able to, put my mind to something. This is what was happening. But one of the things that works magic for me is exercise. I'm not a gym girl. I don't go to the gym. I don't have the discipline for the gym, but I walk a lot. So to help me walk, I have this app where I set the target of how many kilometers I want to walk in a week. And then I have my walking buddy, who is my son. We don't walk together, but we keep each other accountable to make sure that we hit the target. And if you don't hit the target, then you buy something, whether dinner or just something. You owe something to the other person. So that keeps me going. So I strive to walk about 4 days in a week, especially after work. Even now, I'll still go and get some 30 minutes of a walk. The other thing I do is I hike. The best decisions I have made in my life in the last 4 years are decisions I made on my hiking trail. So I hike when I get an opportunity. I go to the high mountains. I go to, just even the soft hikes. I do that. Now I have realized over time, that's my go-to. It's so therapeutic for me when I am on the mountain. Like so therapeutic. There is no internet, and I keep telling myself it's okay, even if the world is burning, there are people who are going to take care of it. I don't have to be the one responding to that. So that becomes my go-to. I have my kind of music that I listen to that calms me down. If I wake up and I'm feeling in a particular mood, then I know the kind of music to play in the car as I'm going to work. If it is after work, I didn't manage to do my walk, then I know the kind of music that, shifts my mood to a certain thing. Then, of course, spending time with my family. Once in a while I'll sit, I'm not the movie girl, but once in a while I'll sit and find a good movie and watch. So it's a variety of things. There are days I will wake up and I'm feeling so exhausted and I just want to sleep, and I'm like, it's never that serious. Let me take care of me so that I can take care of you. So it's to find the things that helps you. And I also try to disconnect. I can just decide my phone is on flight mode or mute. I will respond to all the messages later. Yeah, that's what I personally do. Yeah.
All right. Okay, we have some comments in the comment section and questions from Anne Dirango, such as smooth presentation. From Frederick Maina, thank you, Margaret. You have answered a lot. A lot of the concerns we had, and
Shannon, there are also
From
some questions under Q&A.
Oh, okay. Okay, from George Kema, good presentation. And from Moses Mwaniki, is childhood trauma. Childhood trauma was inevitable to the environment we grew in, hard labor, poverty, punishments, beatings, etc. As a type A personality, what should you look out for before it gets too late?
I think the main things, and by the way, it doesn't mean because your personality type A that you're not okay. No, that's not what it means. It just means you're more at risk of high stress than any other person. You look out for, do you have the, number one, I think is, do you have the capacity to sit still without the feeling of, I have this unaccomplished, this one. And then number two, can you still be grateful and pat yourself on the back even when you didn't hit your target without necessarily giving yourself a beating? Can you still score yourself A for effort? Because the personality type A's will be giving themselves D for effort. Not D for effort, but D for the score, but they probably put in A for effort, but they don't see the A for effort. So if you're struggling to validate yourself, if you're struggling to just remain calm and you're feeling you're constantly under pressure, it's time to, take a chill pill and tell yourself, am I being true? Am I being fair? And am I being, okay with myself? Why am I beating myself too hard? And then, of course, also, because are you taking too many assignments at the same time such that you're having trouble with completion of an assignment? Are you the procrastinating type because you're the perfectionist and you're waiting for a perfect report and all that? You will never have a perfect report. You're not perfect. I am yet to find anyone who is perfect. It's always, is it A for effort? That's what I would tell a personality type A. So when it comes to the mental health, especially for children ages 3 to 5, let me take us back a little and remind us that there is the prenatal stage. And what happened prenatally also influences and shapes your personality later on in life. And sadly, we are seeing children, and my practice, we see children from 3 years who have a lot of trauma in them, maybe because they are witnessing violence at home, or maybe because of what happened prenatally, or maybe because they are being abused emotionally by nannies, by other people, and the caregivers, and they are not talking about it. And especially for a child whose mother struggled prenatally, they are more likely to be children who will end up with a high stress level. So they become very sensitive children. And then, of course, we're also seeing children now with, as very early age who are also struggling with chronic illnesses. We're seeing children who are being bullied. So it is there, but one of the things I would say about children who would be struggling with their mental health is it a child who, have you just observed a change of behavior, like something sudden has shifted with this child? Because if there is a sudden shift in behavior, then that tells you automatically there's something that has happened. So it's important to map out what exactly has changed with that child. And then, of course, because these children, their mothers are working, especially those who don't work from home, they tend to leave them very early at, 3 months, 4 months, the mother has gone back to work. If the child is not left with a caring caregiver, then they have an experience of neglect. And if the nanny or whoever is taking care of them is abusive or neglectful, then that registers in the mind of a child as neglect. So they become high on anxiety. So even later on in life, these are the kids, even in their, late childhood, will still be struggling with some of those especially anxieties, depression. They are struggling with their sense of self-esteem and sense of self-confidence. So yes, the children do suffer or do experience. The treatment for children would be different, pretty much the same way. The doctors are going to be cautious about what do you give to a young child. It's more behavioral through art and play therapy when you're working with children as opposed to pharmacology. But of course, there are those conditions where you're like, yeah, I think they probably would need something. We have very few psychiatrists in the country who are specialized in working with children. So again, like I said, it's making sure your child is being seen by the professional, the right professional, someone who is qualified to work with children. I hope that answers your question.
Okay, Erin, setting work-life balance, and then an anonymous attendee. How would you advise a person who is going through isolation that came about through a relationship?
So the question to the anonymous is, are they still in the relationship, or have they stepped out and checked out of the relationship? Because if you're still in the relationship, then you can be sure the isolation will continue, because you're in a toxic relationship and you're in an abusive relationship, and the person who is isolating you is actually doing that deliberately so that you don't have a good social support system. So what I would tell this person is that now that you've realized you are isolated, that becomes the journey to getting yourself connected. Start where connections or relationship where it's safe. If it is at the family level, even if it is one sibling or one parent that you feel safe to, start to rebuild strong connections and healthy connections. It's also the perfect opportunity now for you to seek therapy, such that even if this person does not allow you to, have in the interim to have the relationships that you would want, that you grow yourself, and through therapy you get the skills that you need so that you can self-manage, and you can get into the point where now you actually get your voice and you can speak up, you open your eyes and to look at the relationship that you're in. But that awareness for me is great. It's excellent. The next thing is, how can I begin to build connections? Is it one friend that I can trust? Is it a colleague? Is it, just someone we went to high school with? Is it one sibling? Begin to build safe connections and safe relationships. Yeah.
Okay. From Dr. George Mugi, great presentation. Thank you. From Farida, thanks for the great presentation. From Mary, I personally believe that over 99% of us in Africa and Kenya grew up in abnormal homes, and we didn't get therapy for it. Thanks for the wonderful presentation.
I think homes have different dynamics. I don't think there's anyone who can say they grew up in a home where there wasn't one or two things that they struggled with. I think the most important thing is to find out what's the impact of my childhood on me, the home environment I grew up. Can I relate something with that? Is it something that requires me to get support from someone else, or is it something that I'm okay with it and I'm living with it? I can manage it, because the thing is managing. Yeah.
Okay. From Farida, have you noticed more mental problems with teenagers who are isolated due to COVID?
Yes, and especially anxiety. COVID had a way of not just teenagers, by the way. I think it's now we are beginning to sort of bounce back to where we were, but teenagers especially really struggled during COVID, because remember that the developmental stage where social connections mean a lot. for them. And one of the things that happened is the social isolation. And also what happened during COVID is that we had now teenagers moving from social connections to now being constantly connected. So we moved from one end of the continuum to another end of the continuum, where now their relationships and their connection is online and not the social connections. So we had children who also are struggling now because of screen time, because of what is happening in the social or media space. But that lack of connection, the social connection at a critical developmental stage where they are forming relationships, even relationships with the opposite sex, they have a very high need for self-acceptance, and their self-esteem, their sense of identity was developing. So that's why now we also now have a generation that is also struggling with screen time because they didn't know how else to do that. Is it very bad? It may not necessarily be, I can't say with certainty in the absence of research that it is everything tied to COVID, because then we have more children now who have access to gadgets than any other time. So some of the challenges we are seeing, especially with the online presence, some of them could have been at the point of COVID, but also because now they have a lot more access to technology than probably 5-6 years ago.
Okay. From Patel, thank you, nice presentation. From Julius Mwangi, well presented. From Lea, eye-opening, very good presentation.
Thank you.
Dr. Barbara?
Yes. So thank you, Shannon. Thank you so much for handling that session. So thank you again, Margaret. I think today has been so wonderful, as many people have also said. And we're excited that this is not the end, that we have another session in 2 weeks, or another webinar in 2 weeks. So that's the 25th of March from 6 to 7, the same time. So please, everyone, remember to subscribe on the portal. And if you have any questions maybe that come up in the next few weeks, please remember to note them down, and you can ask Margaret in the next session. So Margaret, again, thank you for everyone from everyone who's attended today, and from PSK Nairobi branch. My team members and I are very happy and very excited with what you've done, and looking forward to the next webinar. So thank you, and I think that'll be all for tonight. And yeah, thank you for everyone who's attended. Thank you for taking your time. We appreciate it as Nairobi branch. So good evening.
Good evening and thank you.